When I first began my research on nursing in the NHS, I wanted to know what it felt like to work in the National Health Service in its early years. I was curious about the day-to-day interactions that nurses had with hospital staff and patients, and how these changed along with British society in the wake of the Second World War. And I wanted to know about the experiences of nurses from overseas, including continental Europe, Ireland, Africa, the Caribbean, and Southeast Asia, all pivotal in ensuring the continued survival of the NHS. How fortunate I was to come across the Surrey History Centre's mental hospital collections. These collections became the foundation for much of my doctoral thesis about the role of overseas nurses in the NHS, but I believe they have much to say beyond that. They are wonderful sources to learn about the history of nursing and the experiences of caregiving and employment throughout the 20th century. As in Surrey's other mental hospitals in the early to mid-20th century, nursing services at West Park Hospital were directed by women known as matrons. Matrons supervised everything relating to nursing, nursing services, and nursing education. Their role was not absolute. Hospital administrative records reveal fraught negotiations with doctors and hospital managers. But matrons nevertheless exerted immense control over nursing staff, as well as the student nurses who worked on the wards during their training. The matrons of West Park Hospital left behind fascinating documents, in particular these small, fat volumes labeled character books. These books contain demographic information, reports, and evaluations of hundreds of nurses, student nurses, nursing aides, and domestic workers employed at West Park Hospital from the 1920s to the late 1960s. Matrons wrote about each nurse's tenure at the hospital, offering comments on the nurse's personality, performance, and potential. Thanks to the efforts of Surrey History Centre staff, 18 of these books survive today. What do we make of these books and their reports? The entries are short, some as short as a sentence. The longest is still only a few hundred words. A very pleasant woman, reads one report. This girl was a very immature personality and required much supervision, reads another. They give us glimpses of the nurses, but rarely do the nurses get to speak on their own behalf in their pages. And there is often little follow-up. What becomes of the nurses after we read about them here? Despite these limitations, the sources still have much to tell us. Every entry contains the same set of information about the nurses: their age, hometown, previous employer, and father's occupation. From this information, we can infer quite a bit about the women who worked and trained at West Park. Many came from working class backgrounds and previous jobs in factories or as domestic workers. One was a dressmaker. Some had been maids in other hospitals. 2 sisters were waitresses in Yorkshire. For these women, nursing would have been a major step up in the world, with a credential and an occupational future. This was a far cry from the exhortations of nursing leaders in London, who didn't want nursing to be a path to the middle class. Rather, they wanted nursing to be a profession for girls already in the middle class, girls who had some secondary education. But the realities of nursing labor forced their hands. Psychiatric nursing was an unpopular specialty, so psychiatric nurse training schools often lowered their educational requirements and accepted students, like many of the nurses at West Park, who would have been turned away from general hospitals. After the Second World War, West Park began relying on nurses and domestic assistants from overseas. Ireland, Malta, Spain, Italy, Germany, Latvia, British Guiana, Barbados, Jamaica, Trinidad, Ghana, Nigeria, and Singapore are all represented in the books. The registers point at the many different paths these women took to Britain. Some were recruited through employment agencies or through British government programs that recruited Eastern European women into domestic jobs in hospitals. Sisters followed sisters, cousins followed cousins. Friends came in groups of 2 or 3, evidenced by the fact that multiple women gave the same employer as a reference. We can almost see them, 2 apprentice dressmakers in Jamaica or Ireland or Singapore, unfurling their dreams and travel plans along with yards of fabric for dresses. Perhaps they sought recommendations from friends who made the trip the year before, or pooled their money together to book passage to England. Because student nurses and domestic workers lived in hospital-provided accommodations, it was possible to go into nursing with very little money or connections. Although we view the nurses only through the eyes of the matrons who wrote about them, the dry evaluations of nurses hint at deeper stories just beyond the page. The evaluations were usually written just after a nurse left the hospital's employment, and consequently, matron had the most to say about nurses who left under unusual circumstances or were dismissed. Many had become pregnant. Some were dismissed after too many nights out dancing in London, arriving back to their hospital accommodations past matron's 11 o'clock curfew. Some nurses, fed up with the strictures of hospital life, simply quit on a few days' notice. Other stories hint at more difficult circumstances. One nurse left to care for an ailing mother in Ireland, her dreams of making a life in Britain temporarily dashed. Another nurse suffered severe depression and was admitted to the hospital's sick bay, where matron suspected she might have been using drugs. Each entry of the character book gives us a glimpse of a life much richer than a 300-word evaluation, and which extended well beyond the bounds of West Park Hospital. But what fascinating, vivid glimpses they are.